Good afternoon, teacher. My name is Estefania Marroquin, and my classmates Laura Ceballos, Guido Rodriguez, and Andres Angel. We are going to start the exhibition of Taiwan diabetes.
Taiwan diabetes. What is it? Taiwan diabetes mellitus is the most common chronic pathologic in children. It's a disease that affects millions of people worldwide, resulting in poor health outcomes and high healthcare costs. It's an autoimmune disease that occurs when the body is unable to produce insulin due to the destruction of insulin producing cells in the pancreas.
Um, Taiwan diabetes is the most common chronic endocrine pathology in children. It is a disease that affects millions of people worldwide, resulting in poor health outcomes and health care costs. It is an autoimmune disease that occurs when the body is unable to produce insulin to destruction of insulin producing cells in pancreas.
How is Taiwan diabetes diagnosed? You doctor can diagnose with diabetes with a physical exam, medical history, or blood test. Some people are diagnosed with diabetes because they have symptoms of diabetes.
Treatment. Your treatment should include a nutritional diet, daily regulation of physical activity, appropriate use of insulin therapy, and glycemic control.
Signs and symptoms of Taiwan diabetes may appear relevant suddenly include the following: increased thirst, need to urinate often, urinary incontinence in children who didn't know previously wet the bed at night, extreme hunger, unintentional thinning, irritability, and other mood swings, fatigue and weakness, and blurred vision.
The role of insulin. One large number of lesions that have been destroyed later on the or non-insulin will produce insulin and hormone that come from gland behind and below the stomach. The pancreas secretes insulin bloodstream. Insulin circulation, which allows sugar to enter the cell. Insulin reduces amount of sugar in the bloodstream. As the blood sugar level drops, the secretion of insulin in the pancreas drops.
Complications. Over time, complications of Taiwan diabetes can affect major organs of the body, such as the heart, blood vessels, nerves, eyes, and kidneys. Maintaining a normal blood sugar level can greatly reduce risk of various complications. Over time, complications of diabetes may lead to disability or be life-threatening.
Prevention. There is no way to prevent Taiwan diabetes. However, researchers are working on prevention of the disease of destroying islet cells in newly diagnosed people.
Risk factors. Some of the known risk factors for type 1 diabetes are family history, genetic, the presence of certain genes indicate an increased risk of type 1 diabetes. Family history, anyone with a parent, brother, or sister with type 1 diabetes has a slightly increased risk of disease. Geographic location, the incidence of type 1 diabetes tends to increase as you move away from the equator. Age, although type 1 diabetes can appear at any age, it appears in two critical moments. The first critical time is in children between 4 and 7 years age, and the second critical time is children between 10 and 14 years old age.
Heart and circulatory disease, never injured neuropathic, hindic damage, neuropathic damage to the eyes, damage to the feet, skin and mouth, disordered complication and pregnancy.
Diabetes in Colombia. There are 4 million people suffering from this disease in Colombia. In Colombia, it's estimated that between 8.5 and 9% of the adult population has diabetes. This means in the country about 4 million people have this condition, mostly type 2 diabetes. It's estimated that after the age 40, 1 out of every 10 people is diagnosed with diabetes. Of these deaths, 43% occur before the age of 70.
The incidence of type 1 diabetes in Colombia is relatively low. The 3-4 per 100,000 children under 15 years age, and the prevalence estimated 0.0%. One that is in Colombia there is about 30,000 people diagnosed with type 1 diabetes and 2,000 people changed from the conventional treatment of insulin injection to insulin pump treatment.
According to the more recent diabetes report to the World Health Organization, the disease caused 1.5 million of deaths, and the blood glucose elevation above ideal values caused 2.2 more deaths. Today, thanks to the technological, people with type 1 diabetes have new treatment alternatives and can change the daily injection and improve the quality of life.
Conclusion: Type 1 diabetes focuses of keeping blood sugar levels in your target range and doing things to reduce complications. To control your blood sugar levels, you
Blood sugar levels are checked several times a day, eat healthy, exercise with regularity, and insulin given.
there is no cure for type 1 diabetes, but with treatment, people can live long, healthy lives.
Colombia is a country in demographic transition due to the again and the urbanization of the population. The lifestyle change brought about by later process resulted in diabetes being of less 4 times more frequent in the urban population than in the rural population, which offer an opportunity to develop primary prevention strategies aimed at the conversion the ancestral diet, and the maintain good physical condition because combating excess weight and sedentary lifestyle that already established more is more difficult.
However, we have an obesity law and a social security system that cover the majority of the population. You must implement the appropriate measures to reduce these high death rates in Colombia, whose rate is as high in Colombia as in the rest of the world.
First, what you learn from learn that Taiwan diabetes is a complicated disease that affects millions of people through the use blood glucose, where the cell of the pancreas don't produce insulin, among other things like uh, their diagnosis, diagnostic, um, treatment, symptoms, and risk factors. Second, your personal opinion about the project. This project was very interesting. It allowed us to learn more about this affection and the complication for the individual from many social and environmental factors. Cheer. What you can improve for next semester? I can improve much more the way of pronouncing, learn more vocabulary and fluency when speaking English. Speaking